In our study, we compared the results of intraoperative frozen section and final pathology for sentinel lymph nodes and vulva cancer. We assessed 258 groins and found the sensitivity of frozen section for detecting tumor metastases in the sentinel lymph nodes had a sensitivity of 89.7%, specificity of 99.5%, positive predictive value of 97.2%, and a negative predictive value of 98.2%. In our study, we had 4 cases of false negative frozen section groins, where final pathology revealed 2 cases of ITCs, 1 micrometastasis and 1 macrometastasis. None of these 4 patients had a groin recurrence. A total of 30 patients in our study, or 17.3%, underwent a full inguinofemoral lymphadenectomy during the same operation due to the frozen section results. They therefore avoided a second operation. 2 of our patients who had a false negative frozen section did require a second procedure for a full inguinofemoral lymphadenectomy. Vulva cancer is a rare tumor, and lymph node involvement is associated with a much worse prognosis. Full inguinofemoral lymphadenectomy is associated with a high rate of lymphedema. Therefore, it's important to minimize surgical morbidity while maintaining accurate prognostic information. Sentinel lymph node assessment has previously been shown to be an accurate assessment of groin node involvement in vulva cancer. But if sentinel lymph nodes are positive, patients often require a second OR for a full groin dissection. Our study demonstrated that intraoperative frozen section of sentinel lymph nodes in vulva cancer is an accurate intraoperative guide to determine if complete inguinofemoral lymphadenectomy should be performed, and it does not appear to compromise patient outcomes. So vulva cancer is one of the more rare tumors that we deal with in gynecology. And so I think that therefore makes it a tumor that's a little bit more difficult to study. I think we've had a lot of advances in the last couple of years with international collaboration to learn more about the tumor biology, specifically in vulvar cancer, and the role for lymph node assessment as well as adjuvant treatment. And I think it's really important that we all work together, especially when we have smaller patient samples at each center, to learn more about the tumor biology so we can come up with better treatments for our patients.